Alzheimer's disease is, well, a progressive neurologic disorder that affects the brain and results in cognitive impairments such as impaired thinking, memory loss, and sometimes, honestly, even bizarre behavior. Alzheimer's disease is actually the most common form of dementia, and believe it or not, the sixth leading cause of death in adults, according to the National Institute on Aging in 2019. The cause of Alzheimer's disease is not known. However, several factors appear to have some association with the disease, according to the Alzheimer's Association in 2020. These include increased age, especially over 65 years old, tobacco intake, a medical history of depression, cardiovascular or cerebrovascular disease, repeated or traumatic head trauma, and high levels of homocysteine, which is an amino acid used for protein synthesis. Family history also plays a role, like having high parental age or a first-degree relative with dementia. There are also genetic mutation precursors such as APP, which stands for amyloid precursor protein, presenilin 1, presenilin 2, and a polypoprotein EE4 or APOE4, and finally neurotransmitter abnormalities involving acetylcholine, GABA, serotonin, histaminergic, and NMDA are also associated. The brain tissue of patients with Alzheimer's disease has, three distinguishing features: neurofibrillary tangles, which are fibrous proteins, amyloid plaques that are composed of degenerating axons and dendrites, and granular vacuolar degeneration. An autopsy commonly reveals an atrophic brain that can weigh 1,000 grams or even less compared to a normal brain weight of 1,380 grams. The onset of Alzheimer's disease is insidious. Initial changes are almost imperceptible, but they gradually progress to serious problems. Initial signs and symptoms include forgetfulness and short-term memory loss, difficulty learning and remembering new information, deterioration in personal hygiene and appearance, and an inability to concentrate. The brain tissue of patients with Alzheimer's disease exhibits three characteristic features. First, there are neurofibrillary tangles, which are bundles of filaments in neurons that twist abnormally around one another. They're most numerous in areas of the brain associated with memory and learning, fear and aggression, and thinking. Second, there are amyloid plaques, also known as senile plaques. These are deposits found outside neurons in the extracellular space of the cerebral cortex and hippocampus. Amyloid plaques contain a core of beta-amyloid proteins surrounded by abnormal nerve endings or neurites, and then there's granular vacuolar degeneration. This refers to the degeneration of neurons in the hippocampus, where fluid-filled spaces called vacuoles enlarge the cell body, resulting in neuron malfunction or death, according to Detour and Dixon in 2019. Later signs and symptoms include difficulty with abstract thinking and activities that require judgment. There's also progressive difficulty communicating and severe deterioration in memory, language, and motor function. You might notice repetitive actions or perseveration, which is kind of a classic sign. Other symptoms can include nocturnal wakening disorientation and personality changes such as restlessness and irritability. Psychometric testing and neurologic examination can help establish the diagnosis. Amyloid PET scans measure the amyloid B plaque deposits in the brain. EEG, Connecticut scan and MRI may help diagnose later stages of Alzheimer's disease. Testing cerebrospinal fluid for amyloid B, p-tau, and total tau protein content can assess for extracellular deposits, which are major neuropathic signs of Alzheimer's disease. Additional tests may help rule out other causes of dementia, like vitamin B12 deficiency and hypothyroidism. Although there is no known cure for Alzheimer's disease, cholinesterase inhibitors such as donepezil, also known as Aricept, galantamine, or razodine, and rivastigmine, which goes by Exelon, have proven partially effective in improving mental performance for those with mild to moderate disease. Drug therapy is also used to treat behavioral symptoms like aggression, paranoia, depression, and delusions. These drugs include antipsychotics such as haloperidol, which you might know as Haldol, olanzapine or Zyprexa, quetiapine, also called Seroquel, and risperidone or Risperdal. There are also anxiolytics like alprazolam, commonly known as Xanax, buspirone or Buspar, diazepam, which is Valium, and lorazepam or Ativan. Antidepressants are sometimes used too, including amitriptyline or elavil-bupropion, which is Wellbutrin, fluoxetine known as Prozac, and paroxetine or Paxil. Establish an effective communication system with the patient and the family to help them adjust to the altered cognitive abilities. Returning to a safe haven is important. Protect the patient from injury by providing a safe, structured and supervised environment. Encourage the patient to exercise as ordered to help maintain mobility. Refer family members to appropriate social service agencies that can help the family assess its needs. Evaluate the patient. The patient should be free from injury, have an established, adequate sleep pattern, and have adequate nutrition. Assess the patient's family to determine if they have sufficient support systems to help them cope with this crisis. Encourage the patient and the family to express their feelings of loss. Teach the patient and the family about Alzheimer's disease, what's known, what's suspected, and the degenerative nature of the disorder. Listen to their concerns and answer all questions honestly and with compassion. Refer the family to local and national support groups for additional information and coping strategies. Family members commonly find a degree of solace in knowing that other families are going through the same devastating experience. To locate support groups in your area, contact the Alzheimer's Association. Encourage the family to allow the patient as much independence as possible while providing for safety. Explain how proper diet, regular daily routines, and normal sleep patterns can help.